Good afternoon, everybody. My name is Edjah Nduom. I'm an associate professor of neurosurgery at Emory University School of Medicine. I'm one of the co-founders of the American Society of Black Neurosurgeons. And I'm here to tell you that we have a public health crisis here in the Black community and a scarcity of Black physicians, particularly in our very challenging medical subspecialties, is part of the problem. Now, in this room, we all know that Black patients receive worse care on average in the United States and have worse outcomes for everything from maternal mortality rates to just the average expected life expectancy for a Black person in this country, to survival rates from cancer. And these persist no matter whether you control for education or income, or even looking at where some people live. There are certainly differences by zip code, but Black people fare worse when interacting with the Black medical specialty. When they go to the hospital, they don't get the same care that everybody gets. And I can tell you that the lack of Black neurosurgeons, like myself, is not the only reason, but it's certainly a contributor to this problem. And so why am I so confident that that's part of the problem? Well, when you look at the data of what happens when someone goes to see a physician, when a Black person sees a Black physician, they have a better experience. There's statistics that will show that Black people spend more time with a Black physician, that they'll be listened to longer, they'll have more time to tell their story. They're more likely to consider clinical trials. I can tell you that anecdotally from my own experience. When I speak to a Black patient about enrolling in a clinical trial, which for cancer is where some of the best treatments are given, they're much more likely to enroll than when they are spoken to by a colleague that they don't share something with. And Black physicians have been known for a long period of time to be more willing and able to serve our underserved populations in this country, whether that's rural communities or urban communities, where our people are not getting the same access to the high levels of care that other people do. So, I hope that I've given you some of the evidence that Black physicians are really important across various specialties. And that's not to say that Black patients should only ever be seen by Black physicians, or that, my white colleagues and Asian colleagues and Latin American colleagues can't give excellent care to Black patients as well. They can. But Black patients are going to do better when there are Black physicians that are part of their care team in some way, shape, or form, and are able to provide those bonds and listen to those patients and understand what their problems are. So why don't we have enough Black physicians already? There have been Black people that have wanted to be doctors for a long period of time. You think that, over time, that after the civil rights movement and things like affirmative action, maybe we'd have enough Black physicians. But I can tell you that we don't. And this answer, quite simply, and again, it'll be no surprise in a room like this, is systemic racism. Systemic racism has impacts on all aspects of society, including in economics and people getting jobs generally. And those same factors affect neurosurgery as well, and our other medical subspecialties. So when you look at things like the various vestiges of slavery, things like Jim Crow that affected our community for so long, redlining that continues to affect our community today, to mass incarceration, which I started a nonprofit, Physicians for Criminal Justice Reform, to talk about the medical impacts of mass incarceration. All of those things also impact a person's ability to climb to the highest heights of medicine and make it into our medical subspecialties. And it's made it harder for Black people to get ahead in medicine specifically. So even, if you look at Black medical schools, across the country, we don't have a lot of historically Black colleges and universities that have a medical school that train physicians. And part of that is because of the Flexner Report, which was released in 1910, which was released at a time when medical schools were very disparate in the type of education they provided. But it shut down the vast majority of the Black medical schools that were available at the time in 1910 and dramatically reduced our ability to create Black physicians. And those effects are still present today. I mean, you have a situation where when you look at Black male physicians specifically, the numbers of Black men becoming physicians today are lower than they were decades ago, which is a huge problem. Now, I'm fortunate to be a faculty member at Emory University School of Medicine, where I have colleagues like Professor Manning, Professor Bussy Jones, and Professor Heron, who are doing phenomenal work addressing systemic racism across the fields of medicine. But Emory University itself has its own scars. As a matter of fact, there's a viral letter that was circulated in a picture form across social media not that long ago that depicts the story of a young man who applied to Emory University School of Medicine And the letter is informing him that his application fee is being returned to him because he's a member of the Negro race. Now, some people might think this happened, back in the 1800s, or maybe it happened in the early 1900s, but this was in 1959. As a matter of fact, Dr. Hood, he did manage to make it to a different medical school and become a pillar of the Atlanta medical community, was recently apologized to by Emory University for this transgression. But Emory didn't start letting Black people into its School of Medicine until the 1960s. As a matter of fact, because of the long history of Emory University School of Medicine, I likely will not be alive at the time when Emory has been admitting Black people as long as it kept them out. And when you have that sort of history embedded into our various institutions, it's no question, and it should be no surprise that we're still having problems today with having enough Black physicians in our communities, particularly if we're not taking a very specific and focused approach towards increasing our numbers. So where do we stand? Currently, when we look at physicians broadly, Black physicians are about 5.4% of the practicing physicians in this country, whereas we make up a solid 13.4% of the population. And that's a huge gap. And when you look at neurosurgery specifically, the numbers are even worse, with us representing only just under 4% of the practicing neurosurgeons in this country. So when we look at numbers like this, we talk about numbers like this, a lot of my colleagues will rightfully say that one of the things we need to do is focus on pipeline activities. And that's the general idea that we have not a good enough pipeline of Black people that are coming into medicine and coming into our medical subspecialties. And that's the big thing. So we need to go down to elementary schools and middle schools and talk to people and convince them to become physicians and go into subspecialties like neurosurgery and orthopedic surgery and ENT and other of our really coveted medical specialties. And I agree with this. And I think that's something that we should focus on. And I think you'll find that nationwide, Black physicians have been leading the charge on pipeline activities. However, I'm here to say that we don't need to wait for 10-year-olds and 11-year-olds to grow up and become full-fledged neurosurgeons when they become in their 30s, decades from now. There are talented, brilliant Black people today that we could be bringing into medicine, that we could be bringing into neurosurgery, and we're not for various reasons. When you look at the med school level, it's more difficult at the undergraduate level because I don't have the numbers, but even at the undergraduate level, for every Black physician that I know, and I'm sure this is the case for most of the Black physicians that they know as well, I know at least another two or three people for every Black physician that I know that came through undergrad with me when I went to at Stanford University, who are in other very high-powered fields, in the fields of law and business, who started out at school wanting to be physicians. And because of the various kind of hoops that we make people jump through, the classes that they have to take that are specifically designed to weed people out of the field of medicine, they decided to pursue other careers. And they would have been phenomenal physicians for the many wonderful qualities that they have of leadership and dedication to our communities. But we pushed them away. When you actually get to the people that apply to medical school, it's closer to 10%. So we've already dropped from our 13.4% of the population. When you look at the numbers that get into medical school, it's even lower than that, right? Because our admission rate to medical school is not quite as high as it is for people of other backgrounds. And sadly, when you get to graduation, it gets even lower, down below 7%, closer to half of what we are in the population because of the various problems that medical schools have supporting our brilliant Black minds once they actually get to medical school. Now, a funny thing happens in neurosurgery specifically, because neurosurgery is such an attractive specialty, we actually enrich for Black people for applications. And so we actually bump back up to closer to 9% again. So 8.6% of the applicants to neurosurgery in the last data I was able to look at are Black people, which is great. But unfortunately, neurosurgery then turns them away again. And now we get down to acceptance rates of only about 4 to 5%, again, doing worse than the field. And so if our field is not admitting the people that we have present today into our specialty, it's no wonder that we're not going to have the numbers of Black physicians in the specialty that we need. And we're going to continue to have disparities in care, including in neurosurgery and other subspecialties, as we have in others. And, people think about neurosurgery, or maybe neurosurgery is a luxury. You don't need a neurosurgeon. Well, neurosurgeons are involved in trauma. Neurosurgeons are involved in cancer care. They're involved in many different aspects of general health. And so when we talk about that importance of having a Black physician as part of someone's care team, if we're not present in all specialties, our patients are going to be at a loss. So we'll talk a little bit about data. I'm going to talk a little bit about a personal story as well. So what was my introduction to neurosurgery? So when I applied to neurosurgery, this was back in 2005. I'm dating myself a little bit. And in my first neurosurgery interview, this was in October 2005, it was shortly after Hurricane Katrina had devastated New Orleans. My background, my family is from Ghana. I was born in the United States, but I actually moved back to Ghana when I was 11. And then come back to the US for senior high school, college, and medical school. And my interviewer had noticed this and said, hey, I really want to talk to you because I have this really great idea. I've been watching all this footage of Hurricane Katrina. And I was just thinking about ways we could help these people. And I came up with this idea to get a bunch of cruise ships. And we could put all the people on the cruise ships and we could send them back to Africa. What do you think? Now, for the uninitiated that don't know a lot about neurosurgery, it's a very small field. But I've been told many times going into interviews that all the chairs talk to each other. And this was the chair of the program asking me this question, and I had no idea how to react. So trying to think quick on my feet, I said, well, sir, having lived in Ghana, a lot of countries in Africa are actually, kind of poor. And so if we send a bunch of poor people to countries that don't have a lot of resources, they may not do that well. So he sat there and said, well, you might be right. And he moved on with the regular interview, thinking that nothing would happen. And, that interview had my head spinning in circles for the rest of that day and truly for the rest of the interview trail, where I'm trying to put my best foot forward and show neurosurgery that I'm someone who's worthy of them. And I've got this thing in the back of my head saying that they flagged me as something different. And they have these weird ideas about people that look like me. Is this somewhere that I belong? So again, no wonder that maybe Black people aren't performing as well as Indians. Because my story is not unique, and it's not even the worst story that I have in neurosurgery. And things like that continue to happen. So let's say a Black person actually gets into a competitive subspecialty like neurosurgery or ENT or orthopedics. Is that the end of the story? Are they destined to be successful? Sadly, the answer to that is also no. So there's actually been a great investigation that was recently published by Edjah and Stat News. You should check it out if you haven't yet. And it was titled, in part, "It Was Stolen from You." And the reason it was is because you have, again, some of the most brilliant minds coming out of our community that have made it through medical school, that have made it through all the hurdles of gotten into these residencies, and now are getting pushed out of these specialties at a much higher rate than everybody else. When you look at all specialties, you'll find that Black people are, in many cases, as much as 4 times more likely to be dismissed from residency for any particular cause. So again, you have these people that are some of the best that we have in our specialties, even after accepting them and saying, no, you must leave now. And once you've been pushed out, it's nearly impossible to get back in to a productive medical career from them, particularly in these competitive medical subspecialties. In this article, I'm quoted talking about Black women neurosurgeons. The last data that I've been able to look at, there were only 33. We're talking about a large birthday dinner worth of Black women practicing in neurosurgery in this country. So when you lose a Black woman trainee from neurosurgery, that is a felt, real impact statistically in our field. You've lost a unicorn. And it's stuff like that that needs to stop happening if we're going to see change in the percentage of Black neurosurgeons in this country. And why does this happen? Again, it's implicit bias. It's people being not fitting quite what someone's feeling of what we call professionalism is, right? They don't fit in with everybody. We don't quite know them as well as we know the other residents. And because of that, when mistakes happen, as they do when people are learning, and us as physicians that are training these trainees, our role is to make sure that any mistake that someone makes in training is something that doesn't affect the patient, right? And so most mistakes in residency are not going to affect the patient because there's oversight. But nevertheless, for Black trainees, one mistake often creates a cascade that will lead to dismissal. So I've talked a lot about problems today. How do we make this better? First, we need better information on the problem. I've quoted a lot of statistics. A lot of these are things that I've had to scrape and claw and do my own calculations, looking at the raw data that are put out by some of the various institutions that do collect some data on people that apply to medical school, get into medical school, go on to training. But we need to push the Association of American Medical Colleges, the National Resident Matching Program, the Accreditation Council for Graduate Medical Education, to track and publicly provide more widely data on the race of people that are trying to get into these competitive specialties and why they're not making it. We need to be very intentional, loud, and proud of our efforts to improve the diversity of our specialties for the good of the health of all the country. But I haven't even gotten into all of the data that's rich that says that diverse teams do better research. When you have people of diverse backgrounds on a paper, it's likely to be higher impact. When you have diverse minds thinking about a problem, you're more likely to have more diverse and better solutions. So again, for the health of our country, it is really important for us to make sure that we are harnessing all of the brilliant minds that are available in this country for the better of everyone's health. And we need to make sure that those that actually are stewarding and taking care of our brilliant Black minds when they do make it to residency know of their implicit biases and think about them and intentionally try to counteract them so that when they're making their evaluations of these people, that they haven't made it through 30 years of a sterling career only to have their hopes dashed when they're so close to the finish line. Now, before I go, I do want to share a little bit of hope. So, in the data I've been presenting over the past couple of years to talk about this problem, what I would say is that in the past 12 years, there's never been a single year where there've been more than 12 Black people who had matched in neurosurgery in any given year of the 230 to 240 spots that would be available in any given year. And certainly those numbers were even better than the decades prior. And in some years, the number of people that entered neurosurgery was as low as 4. In some years, as that number was the same number of Black residents that were pushed out of the specialty for various causes. However, in 2021, we founded the American Society of Black Neurosurgeons, a like-minded group of physicians that have been founded to support Black neurosurgeons to make sure that they're successful to improve the health of all people. And we've been going around, we've been talking about these efforts and explaining the importance of Black people in neurosurgery and what we need to do and how we need to change things. And in 2022, I have to say I'm quite proud to announce that there were at least, for my unofficial count, 25 Black people, people who I self-identified as Black, who matched into neurosurgery out of the 240 spots available, more than 10%. And again, far and away, more than any year in recent memory or ever. So how did this happen? In a year, we weren't able to, through our pipeline programs, grow up a bunch of 30-year-olds who are ready to apply for neurosurgery residency. The answer is, there's always been brilliant Black people who are ready to be neurosurgeons. There's always been brilliant Black people who could be orthopedic surgeons and ENT surgeons. The change is, we decided to let them in. Now, that's not the end of the story. We have to make sure that we protect these people. We've already had a seminar to explain to them the various pitfalls they may run into during residency. But there is hope that we have the tools to address this problem. There is no doubt that we have a healthcare crisis on our hands, one that was started by systemic racism and exacerbated by a lack of Black physicians to fight it. I'm here to tell you that together, we can bring more of our brilliant Black minds into this specialty, into all specialties, to improve the health of people nationwide. We know what to do. We will be able to change this. It's not that hard, after all. It's not brain surgery. Thank you for your time.